one recommendation would be to give incentives to students to work rurally across allied health, nursing, medicine, dentistry. If you could have incentives to study and then train rurally, whether it's reduced fees, extra support when at uni, it would really encourage people to get out of the cities and the metropolitan areas and try rural life.
There are some really proven approaches to accelerating business formation and business growth, but they've always been generally applied in the tech space. I think we can apply the same principles in the allied health space and thereby support and fast track the growth and sustainability of new allied health businesses and business services in smaller regional communities.
It would be to fund those training positions, more training positions for the health workforce across all the disciplines, Aboriginal health practitioners, nurses, allied health, midwives, doctors, in rural and remote communities for those people from those communities to undertake their training in those communities. So the infrastructure that's required, the coordination, but importantly, fund those training places.
It also requires them to step up and put the same incentives for rural dental workforce as they do for medicine and nursing. We have such inequality, and one of the biggest issues is the fact that we don't have enough dental practitioners working in rural areas, and yet there are no incentives for them to do so. For us in the dental school, rural clinical experience is really integral to us producing good practitioners, but the capacity of rural and particularly remote areas to host students is constrained by their workforce shortages. There is a rudimentary dental rural student placement program funded at the moment, but it's nowhere near funded at the same capacity as medicine and nursing.
The local solutions can be from an Aboriginal perspective, that it has to be run by Aboriginal people. So you look at Aboriginal leadership within the communities. It's community owned, community led. You need to empower Aboriginal people in these communities to be able to make choices, to be able to then practice self-determination and elevate the voices, because often I find that the community do have the solutions. It's just that we need to support them to make sure that they've got the support around them to bring the solutions to fruition.
I would say to give fringe benefits or incentives for people to move to the rural and remote areas as a healthcare workers, because it is really tough out there, both from a cost of living, the living conditions, and they are basically uprooting themselves away from their families. So I understand that money cannot make wonders, but that's a little bit that I feel that the government could point a little bit of money, both from a cost perspective for them to move, to work there, to study there, and to help the community there.
Standardization for better health records. If it's standardized across the whole of Australia, across different levels of care, primary, secondary and tertiary health, then I can see that it can be potentially a very powerful tool for everyone here in Australia.
It would be to listen to the Aboriginal community-controlled health sector and respond to their needs. And what we're hearing from my perspective is that they need more medicines expertise embedded within their clinical services, and that's why we think that there should be funding for a national program to integrate pharmacists into ARCHOs.
I think it's really important that incentives that are out there for individual professions are open to all professions, because there's so many different health professionals that work in rural and remote areas, and it creates inequality when one profession, such as medical officers, are eligible for allowances and incentives and upskilling that the rest of us aren't eligible for. And it'll be excellent to see those opportunities equally shared across all of the different health disciplines that work in rural and remote areas.
To listen to our local senior leaders and clinicians, because we have the answers, we can grow our own solutions, and we can change it up to ensure that we're not continually doing more of the same. If we do more of the same, we will simply get the same result, and it's time for change.